Chapter 8, Special Senses. So commonly we think of our 5 senses when we're talking about quote-unquote senses: touch, taste, smell, sight, and hearing. So the special senses respond to stimuli involved in these things, in vision, hearing, things like balance, smell, and taste. Our body interprets these via a variety of receptors housed in special sense organs, such as the eye, the ear, and the nose, that help to detect stimuli in our surroundings. Without our special senses, we could not smell or taste our favorite foods, appreciate colors, hear your favorite song. Obviously, we know that some people live without one or more of these senses, and they adapt to them, but they're obviously unable to interpret some of these outside stimuli to render, things like taste or colors or, what the sky looks like, etc. First, we'll talk about the eye and vision. So, of all of the senses, vision has been the most studied. I'm sure many of you, if not all of you, have at least been to the eye doctor once. I was blessed with pretty poor vision at a young age, so I first started going to the eye doctor, I believe, in 2nd grade. Nearly 70% of all sensory receptors in the body are in the eyes. The optic tracts that carry information from the eyes to the brain are big bundles that contain millions of nerve fibers. And because of things like see it to believe it, we do rely heavily on sight. The eye measures about 1 inch, but we all know in a normal person that has not had trauma to their eye orbit, only the anterior, that front 1/6 is visible. And accessories and structures include the extrinsic eye muscles, which we learned some of the nerves that control those, the eyelids, the conjunctiva, and the lacrimal apparatus. So here we can see those extrinsic muscles of the eye. There's six external eye muscles that are attached to the outer surface of each eye, and they produce the gross eye movements and make it possible for us to follow a moving object. So here at the bottom, you can see the associated controlling cranial nerve for each eye movement. So we have lateral movement, medial movement, elevated eyes turned medially, depressed eyes turns medially, elevated eyes turns laterally, depressed eye turns laterally. And you can see most of the movement is controlled by oculomotor, which we just learned is a purely motor cranial nerve. So we can see from this image that the eyeball itself is a hollow globe, if you will, hollow sphere, composed of 3 tunics or layers, and its interior is filled with fluids called humors that help this hollow structure to maintain its shape. The lens is the main focusing apparatus, which you can visualize here in this image, right there to the left, and is supported upright within the eye cavity, dividing it into 2 chambers. So there's an anterior segment and a posterior segment, in front of the lens, behind the lens. So here we're taking a closer look at that transparent neural layer. So here you can see the rods and the cones at the top part of the photo, these photoreceptors that respond to light, and then the two neuron chain, the bipolar cells and the ganglion cells. So light must pass through the thickness of the retina to excite, quote unquote, the rods and cones. Electrical signals flow in the opposite direction from the rods and cones to the bipolar cells and finally into the ganglion cells. The ganglion cells are the ones that generate the nerve impulses that leave the eye via the optic nerve. And then in the bottom photo, you can see the view of the posterior part of the eyeball and how it illustrates how the axons of the ganglion cells form the optic nerve, and the site of the optic nerve meets the retina, and it's called the optic disc. So here we can see kind of how the light, or the lens rather, changes depending on where the light source is coming from. So in the left image, you can see light is coming from a distant source, and the light rays are parallel and does not require the lens convexity to really change in order to focus that light on the back of the retina. Below it, you can see light from a near source. And the diverging light rays require the lens to bulge in order to hit that same focal point. On the right, we're looking at what's called real image, so reversed left to right and upside down formed on the retina. So the farther away the object, the smaller the image is on the retina. The normal eye is able to, it's called accommodate properly. However, vision problems occur when a lens is too strong, so over converging, or too weak, under converging, or when there are structural problems of the eyeball. So things like nearsighted, farsightedness. I'm trying to think of what it's called when just the lens is just a little different, mal-shaped, differently shaped. Astigmatism. So notice in this image that the visual fields overlap considerably. That area is called binocular vision. Notice also the retinal sites at which a real image would be focused when both eyes are fixed on a close point-like object. So it's pointing to the fixation points. Each side of the brain receives visual input from both eyes, so from the lateral field of the eye on its own side and from the medial field of the other eye. Each eye sees a slightly different view, but that their visual fields overlap quite a bit. As a result of these two phenomena, humans have binocular vision, so meaning two-eyed vision, which provides depth perception, also called 3D vision, three-dimensional vision. Our visual cortex fuses the two slightly different images to form one picture. So we've talked about some of these reflexes in chapter 7, but let's talk about convergence as well. So convergence is turning toward a common point from different directions. So reflexive movements of the eyes medially when we view close objects. So seen in those cranial nerves. So both internal and external eye muscles are necessary for proper eye function, and the autonomic nervous system controls those internal muscles. The external muscles are the rectus and oblique muscles attached to the eyeball exterior, which control eye movements and make it possible, again, to follow objects. The internal muscles alter lens curvature and control pupil size, so they control how much light is able to get into the eye. So when convergence occurs, both eyes are aimed towards the near object being viewed, and then the extrinsic muscles are controlled by somatic nerves. Like here, it says 3, 4, and 6. So how we test this in practice is, say you have a patient sitting on an exam table and you have a pen in your hand. You're standing about 2 feet away from the patient. There's a clock on the wall behind you. You have them focus on the pen and then ask them to look back at the clock, and you see if their eyes change equally at the same time to focus on that far object, and you can do that back and forth a couple times. The photopupillary reflex. So this is a protective reflex that constricts the pupil upon exposure to bright light to prevent damage to those rods and cones. So this one's very easy to test. You tell somebody to look at your nose, shine a pen light in their eye, and you see if the pupil, gets smaller, which is what it should do under light. You can also note, is the other pupil reacting similarly, because they should be reacting equally, even though the light is only being shined in one pupil. And pupils also constrict reflexively when we view close objects. So this is more when it comes to accommodation. This is like follow my pen in towards your nose, and that we make people go cross-eyed. Now let's move on from the eye to the ear. So here we're looking at the anatomy of the ear. So there's inner ear structure, the vestibule, cochlea, and semicircular canals. And they represent a cast of the cavity formed by the bony labyrinth. Anatomically, the ear is divided into 3 major areas: the external or outer ear. So this is what we can see. The middle ear, and then the inner ear. So the middle ear is, if you've ever had an ear infection, this is probably what your provider is looking at when they stick an otoscope into your ear. They're looking at that tympanic membrane or eardrum to see if there's evidence of infection there. External and middle ear structures are involved in hearing only. And the internal structures here that look kind of crazy, like a little snail, function in both equilibrium and hearing. In your text, it goes into greater detail of the exact structures involved in the external, middle, and internal ear. This picture here just gives us a good idea of the route sound travels through the ear that results in hearing. So to excite hair cells in the spiral organ of Corti in the inner ear, sound wave vibrations must pass through air, membranes, bone, and fluid, and it results in the sound that we hear. So we've now established that the inner ear is responsible for both hearing and balance equilibrium. So the equilibrium receptors of the inner ear are collectively known as the vestibular apparatus. They're divided into 2 branches for monitoring static versus dynamic equilibrium. So you want to feel balanced whether you're sitting still or walking, moving, etc. So let's talk a little bit about static equilibrium. So within the membranous sacs of the vestibule are receptors called maculi, or the literal translation is spots, that are essential to our sense of static equilibrium. The maculi report on changes in the position of the head in space with respect to the pull of gravity when the body is not moving or static. Because they provide this information on which way is up or down, they help keep our head erect, which, as you can imagine, is pretty important. They're extremely important to divers swimming in dark depths, where most of those orienting cues, like light, would be absent, enabling them to know which way is up so that they can surface. Each macula is a patch of receptor hair cells with the hairs embedded in the otolithic membrane, which you can see here in the image. As the head moves, the otoliths roll in response to changes in the pull of gravity. The movement creates a pull on the gel, which in turn bends the hairs of the hair cells, which is it's bananas. Bending activates the hair cells, which sends impulses along the vestibular nerve to the cerebellum of the brain, informing us of the position of the head in space, informing our nervous system of the position of the head in space, so that we're able to remain balanced when we are not necessarily in motion, but when our head is moving. Now let's talk about dynamic equilibrium. So these receptors are found in the semicircular canals, respond to angular and rotational movements of the head rather than those straight line movements. So if you're twirling like this girl in the image, dancing, going on a spinning carnival ride, these receptors are the ones that are working. The semicircular canals each are about a ½ inch around and are oriented in 3 planes of space. So regardless of which plane you're moving in, there will be receptors that are able to detect that movement. Within the ampulla, slightly wider regions at the base of each membranous semicircular canal, there are multiple receptor regions, each called a crista ampullaris, or simply cristae, which consists of tufts of hair cells covered in a gelatinous cap called a cupula. So when your head moves in an arc-like or angular direction, the endolymph in the canal lags behind the movement. Then, as the cupula drags against the stationary endolymph, the cupula bends with the body's motion. This stimulates the hair cells, and impulses are transmitted up the vestibular nerve to the cerebellum. Bending the cupula in the opposite direction reduces the impulse generation. So when you're moving at a constant rate, the receptors gradually stop sending impulses, and you no longer have the sensation of motion until your speed or direction of movement changes. So that kind of explains why, people can ice skate and spin a ton of times and not necessarily get dizzy and fall over every single time. Now let's talk about smell, which can be a pleasant or unpleasant experience. So human smell is far less acute than many other animals, but we can still tell the difference between odors. So, think about people that taste wine and smell wine or coffee, etc. The thousands of olfactory receptors, or that are receptors for the sense of smell, occupy just a post-stamp sized area in the roof of each nasal cavity, which you can see here in image A, where those receptors are. So air entering the nasal cavities must make a 90-degree turn downward to enter the respiratory passageway below. So sniffing, which causes more air to flow superiorly up to those olfactory receptors, is what intensifies the sense of smell. The olfactory receptors are neurons equipped with olfactory hairs. Long cilia that protrude from the nasal epithelium are continuously bathed by a layer of mucus secreted by underlying glands. And when the olfactory receptors located on the cilia are stimulated by chemicals dissolved in the mucus, they transmit impulses along olfactory filaments, which are bundled axons of olfactory neurons that collectively make up the olfactory nerve, which is cranial nerve 1. The olfactory nerve conducts the impulses to the olfactory cortex of the brain, where the odor is interpreted. The olfactory system, the olfactory pathways, are very closely tied with our limbic system. So if you think of like the smell of your grandmother's perfume or the smell of your favorite dish cooking, it'll usually bring up nostalgia. So it is closely tied with that memory emotional center of the limbic system. Now on to my favorite sense, the sense of taste. So taste buds are the receptors for the sense of taste and are widely scattered throughout the oral cavity. Of 10,000 or so taste buds that we have, most are located on your tongue, and a few are scattered on your soft palate, the superior part of the pharynx, and the inner surface of the cheeks. So the dorsal tongue surface is covered with small peg-like projections or papillae. The taste buds are found on the sides of large valate papillae or circumvallate papillae on the tops of more numerous fungiform papillae, and in foliate papillae on the sides of the tongue. The specific receptor cells that respond to chemicals dissolved in the saliva are epithelial cells called gustatory cells. There are long microvilli or gustatory hairs, so I think we're seeing a common thread. There's many quote-unquote hairs doing with our special senses. Protrude through the taste pore, and when they're stimulated, they depolarize and those impulses are transmitted to the brain. So 3 cranial nerves, 7, 9, and 10 carry taste impulses from the various taste buds to the gustatory cortex. The facial nerve, which is 7, serves the anterior 2/3 of the tongue, and the other 2 cranial nerves, glossopharyngeal and vagus, serve the other taste bud containing areas. Because of their location, taste buds are subjected to a huge amount of friction and are routinely burned by hot foods. I'm sure we've all done that. Luckily, they are among the most dynamic cells in the body and are replaced every 7 to 10 days by basal cells found in deeper regions of the taste buds. There are 5 basic taste sensations. So we have sweet, which responds to sugars, saccharin, alcohols, some amino acids, and some lead salts. Sour, lead salts like found in lead paint, which is why kids used to lick walls. Why we don't use lead paint anymore. Sour receptors respond to hydrogen ions. Well, this is probably one of my favorite tastes. Bitter receptors to alkaloids, salty to metal ions in solution, and umami. Literal translation is delicious. A taste discovered by the Japanese, and it's elicited by the amino acids glutamate and aspartate. Umami appears to be responsible for the beef taste of steak and the flavor of good old MSG, monosodium glutamate, which is a food additive. Historically, the tip of the tongue was believed to be the most sensitive to sweet and salty substances, and its sides to sour, and the back of the tongue to bitter, and the pharynx to umami. But actually, there are slight differences in the locations of taste receptors in different regions of the tongue, but the bitter receptors do seem to be more clustered at the rear. Most taste buds respond to 2, 3, 4, or even all 5 taste modalities. Developmental aspects. So sense organs essentially are part of the nervous system and are formed in embryonic development. So remember, it's formed in those first few months. The at least basis for those special senses. All special senses are functional to a greater or lesser degree at birth. Obviously, things like eyesight is something that develops and gets sharper as the infant gets older. So vision is the only special sense not fully functional at birth. Eyeballs continue to enlarge until about age 8 or 9, and then the lens grows throughout life. As aging occurs, the lacrimal glands become less active, so things like dry eye happen, making people more vulnerable to infection and irritation. The lens loses clarity and becomes discolored. The muscles become less efficient. We can't accommodate as well. Both combined contribute to overall decreased visual acuity as we age. So any questions, comments, or concerns, feel free to reach out to me. There is a lot more in-depth information in Chapter 8 in your text. If you use the e-text, if you have access to the e-text, there is also an audio summary at the end of each chapter. The one for this chapter is about 26 minutes long. So you could just kind of listen to it while you're getting ready one day. You will not be tested on this information, but it is kind of cool to know. Again, any questions, comments, or concerns, please feel free to let me know.